Well, good evening, Mayor and Councilmember Lim and other council members. Thanks for joining us tonight. We'll be providing the latest update on where we're at with the COVID pandemic, specifically here in Broomfield, but also in the metro region and the state. Just a reminder, if you're from the public and you have questions, you can type them in the chat and we have our staff on that can respond to them. So with that, I think we'll go ahead and get started. So again, I'm Jason Balling. I'm the Director of Public Health. Joining me today are members of our team, Deb Fetterspill, Deputy Director, Sarah Mock, Director of our Planning and Administration, and then also Zoe Lemieux. So we could go ahead and get started. Next slide. So we're at a pretty critical point when it comes to the pandemic, specifically here in Colorado. What we're seeing is that our infections and hospitalizations have increased steadily for the past 2.5 months. And specifically over the last 2 weeks, the epidemic curve has continued its sharp rise. So what we're seeing right now is more virus that's out there spreading in the community. And with that, we're seeing our effective reproductive number at 1.2. We haven't been at that level for a while, which is concerning. The other key point that's concerning for us as a metro region is in the state is our hospital capacity is very stressed. And that's not only due to COVID, but also due to the potential from the flu and respiratory illnesses, people that are seeking out care that they may not have received previously. And in addition, just the fact that our hospital providers have been so stretched thin from a staffing perspective. So at this point, we're getting new modeling data that shows if we continue on the same trajectory, that our COVID hospital demand will likely increase through November and could reach over 1,500 people that are hospitalized by early December. And again, that's on the current trajectory. If we do see our transmission control decrease, there are some scenarios that show our hospital demand could exceed the December 2020 peak. So again, we'll keep watching this. Extremely concerning from a regional and statewide perspective. Other big news this week is that we're going to focus on increasing booster uptake in our population and vaccinations in those children's ages 5 to 11. We know those are two key strategies we can use to prevent thousands of COVID hospitalizations and deaths between now and the end of February, and the modeling data supports that. And then lastly, based on where we're at with hospitalizations, the Colorado Department of Public Health and Environment and the Metro Denver Partnership for Health, which is comprised of the major health departments in the Denver metro region, issued a public health advisory that we sent out to our community on last Friday. And the idea behind this is to tell the community we are at a place where we're starting to get very concerned, not only with our level of cases, but also hospital bed capacity. Next slide. So as far as statewide trends, what we're seeing is, I already mentioned this, that upward trend of newly reported cases and that hospitalizations are increasing. Again, and this continues to be a major issue with our unvaccinated individuals. I believe the latest data shows over 80% of those that are hospitalized are unvaccinated. So we have to continue to push for those individuals to get vaccinated. What we're seeing in Broomfield is we continue to see a case incidence growth that's going up. And unfortunately, I just saw the latest data that shows we're continuing to see an increase in our cases in Broomfield, and also our percent positivity, which is 9.1%, which is very high and extremely concerning. As far as our total population that's fully vaccinated, we're at 68.5%. And that's good news. We're continuing to see a slight increase with that. Our North Central Healthcare Region ICU bed capacity is at 95%. Again, as I mentioned, this is the highest we've been as far as in the current pandemic, and something that is extremely concerning for us. And then the majority of breakthrough hospitalizations we're seeing during that 70 plus population. So next slide. And this just shows you where we're at as far as those that are currently hospitalized. And what you can see is we have over 1,300 people that are hospitalized statewide. And the key statistic I want to highlight is our ICU bed capacity has dropped to 7% and is in level red. And this is the first time we've seen that since the pandemic began. We have seen the governor has implemented combined hospital transfer plans as part of his executive orders. And so we are seeing the hospitals respond to that as far as transferring patients between the hospital system. Next slide. And then you can see as far as those that are currently hospitalized in the North Central region or the metro area, we have 650 that are hospitalized. This is up from 540 2 weeks ago. And as I mentioned before, our ICU bed capacity is at 95.5%, so going up as well. Next slide. However, if there is some good news in this, it's that Broomfield has done and continues to do well. We're not a significant contributor when it comes to hospitalizations. We have the 5th lowest hospitalization rate in the entire state. And we had 3 hospitalizations in Broomfield for the past 7 days. And we don't want to see any hospitalizations, but when you take the hospitalization rates and then you also look at the just crude number of hospitalizations in some of the larger metro counties based on those rates, we're not the ones that are a major contributor to the hospital capacity being significantly impacted. Next slide. The other thing that we've been looking at, and I just wanted to share, is our 14-day moving average hospitalization rate. So you remember in the first part of the pandemic, the first wave, we saw that significant increase in hospitalizations, and that was the best measure that we had in that point in time to really tell what was going on. And then obviously last September and December through December, you can see we had a significant increase in the number of hospitalizations here in Broomfield. What you can see then is since we started administering the vaccine, that started after January 1st and through the summer months when the 12 to 15-year-old population became eligible, we've seen sort of a slight increase in hospitalizations, but nothing significant. And then we had that significant decrease over the summer months. Where we're at now, which is a little bit more surprising, is we're not seeing a significant increase in hospitalizations when it comes to our 14-day rate, but we're seeing sort of this plateau of hospitalization September through the current date. And then I guess the only other thing that we do see with this number is that fluctuates. The good news is it's decreasing quite a bit over the last week or so, and we want to see that trend continue. And the reason for that is solely vaccinations, that we know that we have a highly vaccinated population. So thankfully, we're not where we were at last fall, leading into the holidays with a significant number of hospitalizations in the Broomfield area. Next slide. And then this is that modeling data I was alluding to before. So our projected hospitalizations in the state, again, shows that if we stay on the current trajectory with no shift in transmission control, that will hit 1,524 beds as far as the number of hospitalizations that are going to occur What you can see then is if we have an increase in booster uptake, we can slightly impact that. And then what you can also see is if we have no shift or no shift on, but we see that 75% of those that are eligible get the boosters, that we can also have a slight impact. So this was looking specifically at, could we impact hospitalizations through boosters? And you can see it has a statewide, a slight impact, but not much. Next slide. And then this shows where we're at if we see a decrease in transmission control. So you can see where we're at with the current trajectory, looking at a peak in late November. And then if we see a 5% decrease in transmission control, we could see our hospitalizations go up to 1,700, which is again higher than what we experienced during the last peak. Next slide. And this just shows where we're at with vaccine effectiveness. And as I've mentioned before, the vaccine is the best intervention that we have right now to get out of this pandemic. And we're seeing the vaccines performing extremely well when it comes to severe COVID hospitalizations and deaths. We are, as would be expected in the data showing, seeing that decrease in vaccine effectiveness with the 80+ population. That's due to decreased or waning immunity over time, and some of those individuals may be immunocompromised as well. So that's one population we do want to make sure that are getting those boosters, is the 65+ population. Next slide. And another effective intervention that we now have in our toolbox that we didn't have last December is monoclonal antibody treatment. And the modeling data shows that we can decrease hospitalization risk by 70 to 80% with increasing the uptake in monoclonal antibodies treatments that are available. And so the state is doing a big push with this, and we're also increasing our promotion of the monoclonal antibodies to our residents, so they're aware that it's out there, and if they do have a case of COVID, that they can go receive monoclonal antibodies shortly after they tested positive and decrease their risk of hospitalization. Next slide. So this just shows where we're at as far as our 7-day incidence rate. Again, we're not heading in the right direction. We've had that sort of plateau with some peaks and valleys from September through now. But what you can see is even with those increases and decreases, we're still at that plateau place, and now starting to see our cases increase over the last 2 weeks. Next slide. And this just shows where we're at as far as our cases and the number that are being driven by the unvaccinated and those that are breakthrough cases. And again, the majority of our cases right now are among those that are unvaccinated. And as of November 7th, 55% of our November cases thus far are among unvaccinated individuals. So I'm tracking this closely to see if we start to hit a tipping point where we see more breakthrough cases versus cases in our unvaccinated population. We're not there yet, but it is a measure we'll continue to monitor. Next slide. But this is the key data that I continually look at. It's the Broomfield hospitalizations by vaccination status. And what you can see is 47% of our September hospitalizations and 69% of our October were among unvaccinated individuals. And then you could see additionally that as of 11/7, we had 4 deaths in October among 70+-year-olds, and 2 were fully vaccinated and living in nursing facilities. The other 2, I believe, were unvaccinated. So what we're seeing with this is what you're seeing sort of play out across the nation and in the state is if you have a community that has high vaccination rates, you'll see less hospitalizations and significantly less in October and November among those who are vaccinated, in the same thing as far as deaths. So it's our best strategy to get out of this. And I'm looking closely at what the boosters are going to do as well. And as you know, we started to roll out the boosters in October. So we'll see how that adds to increasing protection for our population, for those individuals that are getting it, especially in that 65 plus age group. The next slide. And then this just shows where we're at as far as our overall vaccine percentages. And you've seen this slide every time we provide an update. Two key things I want to share is that the state recently updated their website based on the 2020 population estimates from DOLA. So we have done that as well. And given that we had an increase in our population from 2019 to 2020, we saw a slight decrease in our overall vaccination rates, but we're still in, again, that top tier across the entire state when it comes to percent of our eligible population that's fully vaccinated. And when you look at our 65 plus age group, we're number one, I believe, in the state when it comes to those that are fully vaccinated, which is the key populations we're going to focus on when we're looking at potential hospitalizations and deaths. We also have the 5 to 11-year-olds that we're going to track now that they're eligible to receive vaccines. Next slide. And the other thing we're doing now is tracking our booster doses. And this is great news to see that 55% of our fully vaccinated 70-plus-year-olds have received a booster dose. And you see we're about 40% in our 60 to 69-year-olds. So this is, again, is a key message that we're going to keep rolling out. Certain populations are eligible for their booster. Again, if you're in that 18 plus population group and you work in a high risk setting or occupation, you are eligible for your booster vaccine. And the state just recently, in coordination with the CDC, said that the entire state of Colorado is considered a high risk area. So our 18 plus population is eligible to receive boosters if they want to get them right now. Next slide. And this just shows how critical it is for our 60 plus population here in Broomfield. This is our hospitalizations and deaths by age group, specifically for the months of October and November. And what you can see is the vast majority of our hospitalizations and deaths have occurred in that 70 plus age group. That's why we're so focused on making sure that we have high booster vaccination rates within those populations. But we want everybody to be able to get their booster shots as well to continue to protect themselves and protect others from COVID. Next slide. And then I'm going to turn it over to Deb to talk about the vaccine updates and some of the progress we've made here in Broomfield. So Deb, you're up.
Thanks, Jason. So as you are all aware, a major focus for us is rolling out the vaccines to our 5 to 11-year-old population upon approval by the CDC last week. And doses were starting to ship late last week. So here in Colorado and locally in Broomfield, providers have been ramping up their vaccine capabilities and starting to schedule those appointments. And so just to speak for a moment about some of our efforts locally focused on the pediatric population, as has been the case in the past, Broomfield Public Health is really focused on that coordination role across the county to ensure access for our residents, and then as need be, we'll step in the gap filling role if that becomes necessary. And so specifically, we're working with the 2 major school districts serving Broomfield, Adams 12 and Boulder Valley schools to coordinate vaccination efforts at some of our local schools. Additionally, we're working with our pharmacy and our medical providers. And so there will be a number of select locations where either through retail pharmacies or through primary care providers, residents in our community can take their children for vaccine appointments, including one of the options that I think we mentioned last time with Children's Hospital North is offering 3 times a week vaccination clinics in partnership with the state. And we have links to all of that online. Now, certainly as we're ramping up, appointments are booking up. And so we just ask everyone to, know that there is sufficient capacity. There will continue to be appointments, even if we can't get one same day. Also just encouraging individuals to check, with some of the retail pharmacies, for instance, they may not have pediatric vaccines at all their locations. And so just double checking ahead of time to make sure that it's a location that's offering those. But beyond that, for both the pediatric population as well as to promote access to booster doses, or if individuals have not yet received their first dose, we're continuing to work very closely with the state to coordinate opportunities for the mobile vaccine bus to be at locations in and around Broomfield, and where we can reach a good segment of our population. And so that will be places like our library, at events like craft fairs, high traffic areas like Flatiron Crossing, as well as working with individual schools and nonprofits to reach families where they are. So we will continue to promote all of those on our website, broomfield.org/COVID vaccine. As you can see down there on this slide, any events that are open to the public will be promoted there and through our other communications channels. Kind of speaking of that, we are working on a campaign specifically to provide information and support to families who are considering vaccinating their children. So some of the efforts along with that, we're working with the other metro area health departments in Immunize Colorado to kick off a campaign next week where pediatricians and parents will serve as spokespeople to provide information to families. There will also be a regional town hall that will be promoting where families can ask their questions directly as a panel. So really trying to work on not only access, but also education. So that's an update on our efforts. And then certainly with some of the recent policy updates that we'll talk a little bit about here, there are additional individuals seeking vaccination opportunities, and we will continue to provide information as we learn about those. So one of the things that we're sharing is that the legislation, the Colorado Healthy Families, does require employers to provide paid time off for caregivers to take children for vaccination appointments, making sure that people are aware of that. And then certainly major focus in the past week as more details have come out related to the Biden administration rollout of Osha requirements for businesses that have over 100 employees that will now be required to vaccinate staff, and staff that are seeking an exemption will need to participate in weekly testing. And so one of the pieces of information that was just shared was what is the deadline for compliance, which is now January 4th for individuals who work for businesses with 100 plus employees to be vaccinated by January 4th. So I think that takes us to the next slide, Jason. Back to you if you want to talk a little bit about some of
thanks, Deb, for walking us through that. So as far as what's been happening at the state level from a policy perspective, the state mask order was renewed until December 1st, and you can see which facilities it applies to. There was a state public health order concerning hospital capacity and access to care. So again, hospitals are now delaying cosmetic procedures that will not cause harm to life, limb, or function. That was enacted by the governor's office. And then the state public health order 21 requires providers to administer the second booster and additional doses, regardless of where previous doses were received, and requires providers to administer the vaccine to any individual who self-attests that they meet the criteria approved by the FDA and CDC. And then just to submit the reporting requirements regarding that. So next slide. And then, as I shared before, the Metro Denver Partnership for Health, along with the State Health Department, have issued a public health advisory. Again, all the key messages we've shared throughout this pandemic. If you're not vaccinated, get vaccinated. It's especially important to get your booster shot, especially for the 65 plus individuals. Get your children, 5 to 11-year-olds, vaccinated now. Wear masks indoors, especially important for anyone who is unvaccinated or visiting areas where there might be a higher risk of contracting COVID. And you can see some of those areas that are listed. Again, if you do contract COVID, consider seeking out and receiving monoclonal antibody treatments. Those can prevent severe illness from COVID. And if you're ages 12 and older and qualify, you can get those treatments. Host events outdoors whenever possible to increase ventilation. Get tested if you have symptoms, and most importantly, in conjunction with all of these strategies, get your flu shot. So next slide. Next slide, Erin. Okay, yeah, that's what I thought. So that concludes our presentation. I'm sorry, that concludes our presentation, and we're happy to answer any questions you may have. So if you could use the raised hand function, council members and mayor. Councilmember Lim.
Okay, thank you for that presentation, although it contains some concerning data. Is the modeling trajectory that you presented, does it include any assumptions based on the 5 to 11-year-old booster being available? Like, does it have any assumptions of what percentage are getting them, will be getting them?
Yeah, so it did include some assumptions, and one of the scenarios ran that we wouldn't have boosters available. A second one was that we would get to, I believe it was around 25% of that age group vaccinated. And then the third one is based on the goal of the governors to get to 50% that are vaccinated by January 31st. Regardless, with all of those, we don't see it's going to have an immediate impact on hospitalizations. That's more of a longer term strategy to decrease hospitalizations and transmissions going into February.
Okay, you were encouraging people who had COVID to consider getting the monoclonal antibody treatment. My understanding at one time was that, if you just had a very mild case, like a breakthrough mild case, that you didn't, that at least physicians were not encouraging people to get that unless they had, certain qualifying symptoms. Is that still the case, or are they encouraging it more as a routine matter when you get COVID?
Yeah, I would say that definitely if you're unvaccinated and you contract COVID, I would seek out receiving monoclonal antibody treatments. And then if you are vaccinated in one of those high risk populations, again, where you may be more immunocompressed, that it would be a good idea to seek that out as well. And all of that information is available on our website.
My third question, final question is, so with the continuing, well, in Colorado in general, the increase in cases, and Broomfield's plateau in cases, I'm sure scientists are looking at, are there variants that are, that are becoming more prevalent that are that are resistant to the vaccine that's available? So I mean, what's the latest on that?
Yeah, great question, Councilmember Lim. So the latest is, as far as our genetic sequencing and sampling from the labs, it's 100% the Delta variant right now. And that's the thing with this variant, is it's so highly transmissible that I think that what I've heard is they believe will be hard for another variant to take hold and become the dominant strain, given where we're at with this current one. But that being said, we don't know what those potential future variants could look like and how they could impact vaccine effectiveness. We'll have to continue to monitor that.
Okay, thank you. Those are my questions.
Thanks, Councilmember Lim. Mayor.
Thank you, Jason. And yeah, those numbers are creeping up. So it's definitely a bit of alarming. With regard to the OSHA vaccine mandate on places of employment with 100 or more, the senior care facilities, are they mandating vaccines for their staff, or is it just going to be dependent on how big their staff is?
So I might ask Deb to help on this one. My understanding is the senior care facilities are already directed to vaccinate their staff as part of one of our Colorado public health orders. And it was Board of Health rule passed by the state. So, and thankfully all of our long-term care facilities have already vaccinated both their employees and provided the boosters to their residents. And Deb, correct me if I'm wrong.
Yep, that's correct. The State Board of Health passed rules that all health facilities, including long-term care facilities, needed to enact a mandatory vaccination policy for COVID-19.
And then, Mayor, looking more broadly, the way the Biden administration is going to address that is anybody that's reimbursed for Medicaid or Medicare will need to show or demonstrate that they're vaccinating both their employees, but then that'll also apply to long-term care facilities. Yeah.
That's good. Have you heard anything on whether the state is going to implement any more restrictive orders?
I think everybody's asking that question, and I know it comes up with the governor's office on his weekly press conferences. I could say we've had those discussions with the state health department around what can we do in the metro area, and I continually look at where Broomfield is in this overall big issue, and the policy strategies that are out there. One is obviously to look at masking and whether or not the state's going to do a state mask order. When I look at if we did it in just Broomfield, I'm comparing our case rates and overall hospitalizations to Boulder and Larimer County. And I'm not seeing a significant decrease in their case rates or hospitalizations. So if we start to see that tip and change, I think then obviously we could have a discussion if that's needed specifically in our county, but that would be a strategy that I believe has to be done statewide. And then the other strategies that are out there is some of the other public health departments have passed public health orders, either requiring their government employees to be vaccinated, or secondly, requiring them to be tested. And that's something, again, we'll continue to watch with OSHA and see what it looks like as far as for our county and municipal employees in the region.
All right, well, that sounds like a good plan. I guess
I
my
was
only
just going to add, I guess one other thing there, the best policy that we could have right now out there, it's honestly to make an impact on hospitalizations is to get our unvaccinated individuals vaccinated. That's where we're going to put the greatest dent in hospitalizations, because we see they're the main driver of hospitalizations. So that's what we're sharing with the governor's office. If if there's a policy lever they could pull, hopefully it will be on increasing vaccine rates among the unvaccinated.
I agree. And knowing that our hospitalization rates are so low, I agree with, the path that we're on. With the holidays ramping up and events and parties, are we going to send out any additional guidance?
Yeah, so similar to what we did with the public health advisory, we'll also send out additional guidance for the Thanksgiving and upcoming holidays over the December months, so that people or our residents know what actions they can take to protect themselves with high COVID transmission occurring. But again, the most important step they can take is, if they're not vaccinated yet, get vaccinated and get their children vaccinated who are now eligible.
Excellent. Well, thank you very much. That's all I have.
Thanks, Mayor. Councilmember Schaaf.
Thank you, Jason. Can you hear me all right?
Yeah, we can.
Excellent. I'm going to keep my video off because I'm not on a good Wi-Fi right now, but hopefully this will stay connected via audio. So this last week, I attended a couple large events. One of them was a event where you were required to be either you had to show proof of vaccination or a negative test result within the last 72 hours. And then the other event was you either were required to show proof of vaccination or get a negative COVID test there at the door, a rapid negative COVID test. Have you seen this actually is working for these events? Have we seen that the cases continue to remain low, outbreaks in these kind of environments? And is this helping to ramp up vaccination rates?
Yeah, thanks, Councilmember Schaaf, for that question. Boulder has a program that's somewhat similar to that. We call it the vaccine passports, is that sort of policy option. And what they have is you're required to mask indoors unless your business entity is certified that you can show that your employees and your guests are vaccinated. As I mentioned before in the presentation, we're not seeing a significant change as far as percent hospitalization and percent cases between Boulder and us. That being said, it's a highly effective strategy, in my opinion, for those entities, business entities that want to implement it, because you're decreasing the chances of transmission within your specific event. And then the second part of that is my assumption is you'd be able to attract more customers that would potentially come in. I know myself as a consumer, I'd much rather go to a place where I know it's a safe space versus going to an area that doesn't have those types of protections in place. But to answer your question, Councilmember Schaaf, that's something that we've posed both to the State Health Department and had some discussions with some business leaders regionally on how can we encourage more of those types of settings and venues.
Well, thank you for that. I mean, I think that anecdotally for myself, as well as a couple of people that I talked to, they were much more willing to go to those events and they were much more comfortable at those events. So, I think that, it's one of those things where we're just trying to get through the pandemic, phase. And these are those mitigation measures that we'll see that we can just get through this. So thank you for your time. Thanks for the presentation tonight.
Thanks, Councilmember Schaaf. Councilmember Anderson.
Oh, thank you for this presentation. I just want to first share, as a parent of a younger child, that there is a lot of enthusiasm and excitement about the vaccination being available. So I've been looking for those clinics. And then my question is, we have we still have a lot of, not a lot, but 10 to 20% of the population that has not been vaccinated. And there's this thought that if they did get COVID, that they would have access to, hospitalization and the services that they need. But could you explain a little bit about what crisis levels of care means as where hospitals are filling, and how we get that message out that there might not be the perfect hospital bed awaiting you?
Yeah, thanks, Councilmember Anderson. So we're also thrilled to see the level of interest in the vaccines among our Broomfield parents. There is a high level of interest in the state and region for people that want to get their kids vaccinated. So that's great news thus far. Regarding your second question in crisis standards of care, so the state has a crisis standards of care plan, and it hasn't been activated yet. But if it is activated, it gives those hospital systems under the direction of the governor's emergency response medical committee to triage care. And that will not only impact those individuals that are unvaccinated, but it'll impact individuals that have been vaccinated and are seeking care as well. And what you'll recall is sort of when we went down this road the last time was they first put off elective surgeries and then started triaging which patients can we care for. Thankfully, we're not there yet, and hopefully we can stem this before we start to approach that situation. But that is one concern for all of us with the hospital system right now, is it not only impacts those individuals that are unvaccinated, it impacts all of us too. And do you have any more questions, Councilmember Anderson? Okay, I think we might have.
Okay, thanks. Sorry, I couldn't find the unmute button. No, that is all the questions I have, and hopefully we see a downward trend starting here soon, and we all do our part. Thank you.
Yeah, thanks, Councilmember Anderson. Do we have any more questions from council members? Well, I appreciate your time. And again, when you recall, we started this journey in the fall, we said we had 3 main goals. One is we wanted to keep our hospitalizations low in Broomfield and not breach that hospital capacity. Well, we've done our job of stepping up, and we want to continue to do that, even though we're seeing high case rates. The second thing we wanted to do was keep in-person learning and keep our kids in school. And again, thankfully, with the mitigation efforts that are in place right now, we're seeing that occur. The last thing that I would just ask people to do right now is be aware of where we're at as far as community transmission, follow those recommendations we put in the public health advisory. And then again, if you're unvaccinated, now's the time to really consider and even pursue getting your vaccine, not only for yourself and your loved ones, but for everybody in the community. And with that, that concludes our presentation. Thank you.
Thanks, Jason and Deb and team.